Well, the number of babies born using in vitro fertilization, or IVF, has reached an all-time high. And experts say that the technology for this procedure is always improving.
And now some doctors are offering patients an alternative to the traditional IVF. Susan Kim has a look at the procedure.
Less medication at a lower cost. Does this so-called mini IVF maximize results? When Nauberban Lewis used IVF to get pregnant with her daughter, the fertility medications caused physical complications that landed her in the hospital. So when she and her husband wanted to try for a second child,
traditional IVF wasn't an option for me personally because I did not want to risk going through overstimulation again.
Freddie Baranoff also tried IVF, but found it difficult emotionally and physically. When it came to try again,
I absolutely did not want to do injectable fertility meds.
So both women opted for a newer procedure, minimal stimulation IVF, or mini IVF. The idea? Use less medication to stimulate the production of eggs for fertilization. Experts say less medicine can significantly lower the price and mean fewer side effects.
The mini IVF was more gentle on my body for sure, and not a huge financial burden compared to before.
Dr. Lyndon Chang performs mini IVF.
We are just seeing the demand grow daily. The technology in IVF is always evolving. It's always improving.
But with fewer eggs to work with, some experts are concerned minimal stimulation might not be as effective.
If you're working with fewer eggs, you might actually result in a lower chance of getting pregnant. Right now, the concern is it might be less expensive and less effective.
Studies comparing both procedures are limited. If you're considering mini IVF, it's important to choose skilled doctors since they'll have fewer eggs to fertilize.
You don't have so many materials to work with, and there's no room for error.
As for Nauberban and Freddie, both had success with mini IVF and are grateful they learned of the procedure.
I think it is extremely important for women to know that there is another option out there for them.
Mini IVF is about half to a quarter of the cost of regular in vitro. Susan Kim, today's TMJ4.
And mini IVF is recommended for younger patients because they are good candidates to produce higher quality eggs.